Okay, so in terms of the offshoots of the osteopathic profession, in our next week, we're going to talk a lot about chiropractic. And there's kind of a crazy cat named Dee Dee Palmer who is said to have trained with Andrew Still. And he is kind of the father of the chiropractic profession. So we'll talk about that next week. But he's a very interesting character, he and his son both. Then we have Rolfing. Rolfing, the founder of Rolfing was Ida Rolf, and rumor has it that she learned her techniques from a blind osteopathic physician and then combined what she learned from the blind osteopath with her knowledge of yoga to create this technique called Rolfing, which is essentially like a systematic protocol for whole body structural integration. So I'm going to touch on Rolfing when we talk about massage and body work in the coming weeks. Another very important offshoot of osteopathy is craniosacral therapy, and I kind of alluded to this in the history when I was talking a little bit about Andrew Still and the rope, the rope under his neck thing. So craniosacral therapy was essentially founded by another osteopath named John Upledger. So the Upledger technique is what craniosacral therapy is. And craniosacral therapy is an interesting modality as well, where basically they use mixed cranial techniques with other manipulative techniques that were taught by Still, and this kind of a light trance work, which all kind of sews together to this practice, which is called craniosacral therapy. So craniosacral therapy is practiced by some osteopathic physicians. It is well, kind of today it's sort of hit or miss depending on whether or not osteopaths even really learn a lot about manual medicine. But there are historically osteopathic physicians who do craniosacral therapy, but it's not the therapy is not reserved for physicians alone. There are lots of people who just learn craniosacral therapy through the Upledger Institute or some other educational facility that teaches craniosacral therapy. It's a really cool modality, and I'm going to talk some more about that. I'm not an expert in craniosacral therapy, but I do have some personal experience with craniosacral therapy. That was really transformative that I'll talk about later on and some of you might also have some experience with craniosacral therapy that you can share. But pardon me, it can be a very powerful modality. And then there's all kinds of other sort of physical therapy techniques that sort of are offshoots of osteopathic techniques. And we're going to talk about some of the more specific osteopathic techniques in a little bit. All right, so again, the osteopathic philosophy, this should bring some bells in reference to the holistic theory that we talked about in previous lectures. One, the osteopathic physician is going to ultimately identify the nature of the patient. The philosophy is then going to define the mission of the physician, and then it's going to establish some kind of logical diagnosis and treatment. Right? And really, classical osteopathic philosophy is gonna, really look at the human being as a trinity, including body, mind, and spirit. Right? That's the holistic theory. That's what Andrew Still spoke of a little bit, but he kind of left out the spirit or the mind, right? He kind of really focused more on the mechanistic kind of action of the body, the sort of machine analogy, right? This this, if you tune up the machine, it will function perfectly, and if the structure, of course, is also perfectly aligned. So really, that's, I think, why us, probably in a lot of reasons, why is probably one of the main reasons why osteopathic medicine has been adopted and really accepted by the allopathic profession, is because it really does, classically, it really does focus on structure and function, right? And leaves out all the hocus pocus stuff. And I use those terms loosely because I personally feel that the mind and the spirit should be brought in, as I'm sure you guys have probably gathered. But because he didn't really emphasize that, I think that it's been easier to assimilate. So again, kind of classical andro still, health emerges when form and function are perfectly expressed. No single part exists independent of the whole, and when even a small part of the body dysfunctions, the entire organism is affected. So that all is going to be where this manual medicine and all of that kind of comes from. If you go back further in our history of medicine, right, the Greeks and the Egyptians and all those people, they really talked more about the mind and the body and the spirit, all three, the sort of trinity. And of course, Chinese medicine, which we haven't talked about yet, but we will, Ayurveda, all of those modalities incorporate all three aspects. But Andrew still kind of stayed away from, the sort of more philosophical approach, and really didn't spend a lot of time talking about didn't question some of the more larger philosophical questions, right? And instead focused more on relationships between structure and function, or anatomy and physiology. He did a lot of history taking, observing and palpating the body, adjusting, doing manual medicine and that kind of thing. I think he did believe that the body was self-regulating and that the body had the potential to heal, but he didn't really get into the spiritual aspect of that at all. And that idea, that's what they refer to as vitalism. He kind of left that out. All right. Okay, I just told you all of that. Sorry. So Andrew Still's writing really focused, like I said, there on that last bullet on science rather than on vitalism, which again is more philosophical, if you will. So there is this inherent wisdom in each of us, right? And this kind of like all-knowing restorative force, an intelligence within every cell that keeps the body well. When a state of discord arises, this healing force acts to restore functional balance and harmony. That was said by, I believe, Andrew Still, although I don't have his name written there. So in classic osteopathic philosophy, they talk a lot about, you'll see reference occasionally in some texts to the rule of the artery. And they say the rule of the artery is supreme. And essentially what that rule of the artery, and you kind of have to, again, rewind, because there wasn't a lot of, we didn't know a whole lot about physiology in the kind of detail that we know now when this was all happening. And so essentially by saying the rule of the artery is supreme, what they're basically saying that when the body fluids can flow freely, unimpeded, but then when we talk about body fluids, we're really thinking about the blood and the lymphatic fluid. So when blood and the lymphatic fluid can flow freely, the tissue then can perform their physiologic functions without impedance. And what that means essentially is if you apply that to what we know about physiology currently, is the blood and the lymphatics work in tandem, if you will, or in concert blood delivery is responsible, our blood is responsible for delivering all of our oxygen and all of our nutrients to all of our body cells everywhere. I don't know how much you guys know about the body at this point in this stage of the game, but essentially the circulatory system, it consists of all the blood vessels in the body. And so the blood vessels that leave the heart and travel away from the heart are called arteries, and they carry oxygenated blood, right? Our red blood cells are designed perfectly to carry huge amounts of oxygen. So we pick up oxygen in the lungs, we take it to the heart, it gets pumped from the left side of the heart, it travels throughout the entire body. These red blood cells travel throughout the entire body, oxygenated through the arterial system, and then they move into these tiny little vessels called capillaries, which are every cell in your body is right next to or a couple cells away from a capillary. So when the blood flows into a capillary, the oxygen can leave the red blood cells release the oxygen, and then waste products that are produced in cells as a result of cellular metabolism move into the blood, and then they travel through the tail end of the capillary into the venous system, into your veins, which carry now largely deoxygenated blood, not totally deoxygenated, but largely blood without oxygen, because the oxygen's left and gone to our tissues, so it can make do everything we need to do. And the wastes come in, and then the wastes travel back to ultimately through the veins to the right side of the heart, and then ultimately to the lungs. And the primary waste that we're talking about here is carbon dioxide, and we blow it out, right? So blood has to flow unimpeded for cells to do what they need to do, right? A tissue is just a group of the similar cells performing a common function. So tissues can't do their job if they don't have the resources, right? And the primary resource is oxygen, right? So by allowing for blood to flow freely, that means that tissues are going to get the nutrients and the oxygen they need, and they're going to be able to get rid of their waste. So that makes sense, right? They didn't know that maybe then, but or in that kind of detail, but it makes sense. And so if you are able to if you're able to apply a therapy that allows blood and lymphatic fluid, lymphatics are arguably just as important, if not more important. The lymphatics will suck out anything that's leaked out of a capillary, and moves it ultimately back into circulation, and goes through lymphatic channels, and goes through lymph nodes and lymphatic organs where there's huge numbers of white blood cells to knock down anything that might potentially be problematic. So you want blood flow and lymphatic fluid to flow freely. If something impedes the flow, then the physiologic functions are going to get messed up. And so basically what they were saying with the rule of artery is supreme is by using these techniques, these osteopathic manipulations, it maybe allowed electrical activity to flow better through joints and out of spinal segments, but also improve blood flow and lymphatic flow. So all of that makes sense, right? It all makes a lot of sense. And that's kind of the cornerstone, or that this whole philosophy is built upon. So when we look at a little bit more contemporary osteopathic ideas or philosophies, there's an association, which you're going to get to look at, the Primary Osteopathic Association's website this week as an assignment. So the American Osteopathic Association kind of laid down their more contemporary principles in a statement that was published in 1998. And so what they stated these are the main concepts of osteopathy, one of which is the human being is a dynamic unit of function. 2, the body possesses self-regulatory mechanisms that are self-healing in nature. 3, structure and function are interrelated at all levels. And 4, rational treatment should be based on all of these principles. And again, those principles are the human being is a dynamic unit of function. the body possesses the ability to self-regulate and self-heal, and that structure and function are intimately related at all levels. So that's kind of the contemporary osteopathic philosophy, right? Begins with what we would think about in classical osteopathy, and then integrates additional knowledge, right? So, it's rather than you can either use medicine or manual therapies, they've switched to both are appropriate, and I think that is probably very helpful. And if you can find an osteopathic physician that actually does incorporate both, you have a really good practitioner potentially on your hands. Other changes have evolved recently, because we have more knowledge of nutrition and exercise, environmental factors, genetics, all these kinds of things have been, of course, incorporated. Still didn't talk a lot about, diet and nutrition, but you have to kind of think, and I think this is important. Because it wasn't discussed in philosophy doesn't mean that it wasn't important. But at the time, you didn't have to talk about diet because the people ate pretty much nutritious food, right? They didn't have all the processed junk that we have in this day and age, right? They all crops were grown organically. They didn't have any pesticides. They didn't have to talk about this stuff. They didn't have to talk about eating, trans fats, because those things didn't exist at the time. So just because they didn't talk about it, or they didn't talk about exercising, most people were laborers, right? They walked and they rode horses, so I think it's important to just, even because they don't talk about these things didn't mean that it's not important, right? Didn't know anything about genetics. They couldn't talk about that. There wasn't any biotechnology at that point. So as our knowledge expands, of course, more and more osteopathic physicians are incorporating these sorts of ideas. All right, so let's talk a little bit about some of the techniques, the manual medicine techniques. And I'm not going to go crazy on them, but I'm just going to try my best to explain what I know about these techniques. So there's a lot of them, and of course, depending on the circumstance, different techniques would probably be utilized. Osteopathic medicine is not just a system of techniques, which makes it a little bit different from the traditional chiropractic kind of approach, which we're going to talk about next week. So the first I want to mention are soft tissue and lymphatic treatments. So soft tissue treatment was really basically a direct treatment. It was really developed by Still and some of his early students, and sometimes kind of gets confused with massage. Soft tissue techniques focus on kind of playing around with the tone of muscle and connective tissue, the tone and the length of muscle and connective tissue. These treatments oftentimes are able to relax muscles and connective tissue, maybe remove tension, impediment, and by doing so, that can increase delivery of blood, arterial delivery. Also, and probably most importantly, some of these soft tissue and lymphatic treatments are able to alter the tone of the autonomic nervous system, which in this day and age is kind of a hot topic. So the autonomic nervous system is composed of two arms, if you will. One is the sympathetic nervous system and the other is the parasympathetic, and the two systems tend to oppose one another. So for example, one would increase heart rate, the other would decrease heart rate. So they have the ability to modulate one another. And autonomic tone is something that's really important for basic homeostasis and balance in the body. And so it seems that these soft tissue treatments are able to definitely alter the tone of the autonomic nervous system. They also able to affect the lymphatics, and there are some other more specific lymphatic techniques that are utilized in osteopathic medicine and also some other massage and other types of body work. And they increase the return of the lymphatic fluid back to the lymphatic system. So those are called soft tissue and lymphatic treatments. Another type of treatment is called high velocity, low amplitude thrust. And essentially what this is a direct method of treatment that essentially engages the restrictive barrier of the body by really precise positioning of the body. So basically, you would thrust when the body part is at its barrier, at its restrictive barrier. So essentially what you do is you take someone to the edge of their range of motion, and then you give them a rapid and high velocity thrust. And that thrust then kind of operates over a very short distance, which means low amplitude. And essentially what it does is it causes a kind of a gapping of the joint spaces where two bones come together by just a little bit, by like less than an eighth of an inch. And essentially what this does is it resets both the joint position and muscle tension levels. And that can free up the ability for nerve impulses to travel, and also can readjust the blood flow. All right, another type of technique is called muscle energy technique. This was developed by another osteopath called Fred Mitchell. And it's a direct treatment. And essentially what muscle energy means is the patient uses his or her own energy through directed muscular cooperation with the physician. So basically what it does is it makes reflexive changes in muscle tension. And it allows shortened muscles that are dysfunctional to lengthen, or maybe abnormally lengthened muscles to shorten. Weakened muscles strengthens, and muscles that might be hypercontracted can relax. Sometimes they'll do isometric contraction of patients' muscles, followed by a gentle stretch of the contracted tissue. And that oftentimes can decrease any kind of like abnormal motion restriction. Another kind of muscle energy technique uses traction on the muscle to basically pull the joint back into the appropriate position. So those are some options there. Another technique is called the articulatory technique. An articulation, that term I've used it a few times and I should have defined it. An articulation, when something articulates in reference to the body, is where two bones come together. So at joints are areas of articulation where two bones meet. So this original articulatory technique was developed by Still. And basically, again, it takes the body part that's being treated to the end of its restricted range of motion in a kind of a gentle and repetitive fashion. In my training as a naturopath, we learn a lot of these techniques as well. And this is one that I have found to be really useful and mostly pretty easy to perform, which is nice. Whereas the high velocity, low amplitude thrust is a little bit more challenging to get the hang of. But this sort of articulatory technique is nice. And so basically what you're doing is you're just kind of moving someone to their edge repetitively. So you back it off, you move them back to their edge, and that oftentimes that repeated motion decreases the restriction. Why that's happening, I don't know. I mean, I kind of think of it as you're just kind of you're sort of like training the body and letting them know that they can safely, the muscles safely can let go around the joint spaces. That sounds kind of weird and out there, but that's in my mind, after doing lots of body work for years, that's in my mind what's happening here. These particular techniques work really well for shoulders, which are kind of historically difficult to manipulate, and also really well for the cervical spine, which is another area where lots of people aren't super excited about high velocity, low amplitude thrusting. It's scary for some people. And so this kind of technique is also really helpful. Okay, what's another one here? Counter strain technique. Counter strain is another passive positional technique that puts a person's dysfunctional joint in a position of ease. And it seems like, so an example of this would be like, let's say somebody has a really sore, a really locked down shoulder, right? And so it's causing so they're really contracted, and it's causing them, oftentimes that can be due to like, and I think most frequently is due to the muscles in the neck, like especially the big muscle that kind of runs from the back of your neck, the back of your head, and it runs kind of crosswise diagonally, and it attaches at the front, kind of like on your collarbone. That's a big muscle called the sternocleidomastoid, which oftentimes gets contracted, especially if people are really stressed. And that can cause it can give them headaches, it can cause their shoulders to feel really tight. So this counter strain technique is super helpful in situations like this. And so basically all you do is you take that shoulder and you would kind of lift it up, so they're in a relaxed position, and you, the practitioner, is moving the joint. So basically what you do is you move it into a place where it feels comfortable. So in that example, what you would do is you'd lift the shoulder closer to the ear, and that would feel comfortable because they're contracted. And the idea here is when you do that for them, it kind of resets there's receptors, they're called mechanoreceptors, they're mechanical receptors, that oftentimes are kind of overfiring. And when you put them in a place of ease and hold them there, and usually you're holding them there for, a minute and a half to 2 minutes, that oftentimes it will release. That's what they mean by counter strain technique. Anyway, that's another useful type of manipulation. And there's offshoots of that. They kind of do a lot of palpation. They look for tender points. That's one way you can do it as well. So this is a super great modality for somebody who might not like thrusting, right? That or you're worried about thrusting because they're post-surgical, or they're maybe osteoporotic or something like that, and they have brittle bones. All right, another type of technique is called myofascial release. Myofascial release is actually a renaming of an osteopathic technique that was developed by Andrew Still, and it was called fascial technique initially, but it got renamed, and basically they, in this case, what they do is they lengthen a contracted tissue, or they shorten it. So essentially by lengthening or shortening a contracted tissue, the idea is that it allows for the nervous system and the respiratory system to facilitate the changes that will then hold after the treatment has been completed. And there's a whole bunch of different ways that they kind of work into this. They use compression, they use traction, they use torsion. There's all sorts of things that facilitate treatment in this case. Cranial manipulation is really, remember I mentioned just a little while ago that offshoot of osteopathy, which is craniosacral therapy. Cranial manipulation is a big part of traditional osteopathic treatment. There was an osteopath by the name of William Sutherland that was kind of credited with really like bringing cranial work into the osteopathic profession. And basically, they do this by it's very subtle kind of manipulation, and they use both indirect and direct procedures that kind of work with the body's rhythmic motions. And they are used a lot in adults that have headaches, TMJ, temporal mandibular joint dysfunction. They use them a lot in infants, and I'll give you I mentioned this, and I don't know if I'll get back to it, so I'll give you an example of my own personal experience with cranial manipulation. So when my son was born, he was born very quickly, and he didn't appear, well, there was a lot of things that seemed to be not exactly going well. And mainly, like, he was very colicky. He never slept, ever. He was just kind of not, just didn't seem right, I guess, is the easiest way to say this. And so I was in school at the time, and I was in school with an osteopathic physician who was also training to be a naturopathic doctor. And so I took him, and he was like, I don't know how old he was. I can't remember. Like in the year old, so maybe a little less. Anyway, he wasn't sleeping, and he was just cranky all the time and crying and edgy, and there's all sorts of things happening. And so anyway, I took him in, and she happened to be on shift. She was doing the rotation on the clinic shift that I took him into. And she did cranial therapy on him. We talked for a while, and we talked about his birth. She asked a lot of questions because that was kind of what she was into. And she palpated his head, and she said, I think because he was born so quickly, I think there might have been his bones of his cranium, she thought, kind of got jammed, I guess, for lack of a better term. And as he was developing, they hadn't quite relaxed. So the bones of the cranium, so in between all the bones of your skull, they're all joints, actually, and they're not immovable, although they don't feel like they're movable. But in babies, they're very definitely movable, right? There's more space in between there's more connective tissue in between the cranial bones, because the baby has to come through the birth canal, and so their whole head has to like squish significantly. Anyway, so her idea was, like, in that process, his bones got too compressed and hadn't quite relaxed. And so she did her diagnostic technique to determine this, which at the time, I don't really remember all that much. But anyway, she asked if she could do some cranial work on him. And so I took him in. We did the first time, and then we went in a couple more times. And after the very first treatment, we went home. He fell asleep, which never happened ever, and slept for, I think, like 4 or 5 hours, which was like unheard of. And at my state of sleep deprivation at that point was like nothing short of a miracle. But anyway, after the series of treatments, everything just started to improve, right? He wasn't as colicky. He wasn't as agitated. He was sleeping much better, and everything just seemed to be working better. He very soon thereafter started moving around a lot better. He was kind of late to do a lot of things in terms of mobility. And I don't think it all had to do with that. I think there's other things at play there. But anyway, it was dramatic, is my point. It was a dramatic intervention, and it was super cool. And I was immediately a convert to cranial therapy, and then went on to do some training in cranial sacral and actually utilize that still currently in whenever I do body work, I always do cranial manipulation. And it's very subtle, but it can be quite profound, especially in certain conditions. Okay, and the last one I want to mention are visceral techniques. So visceral techniques are basically a variety of techniques that have been around since the beginning of the profession to address specifically imbalances in the viscera, and viscera means like internal organs. So these techniques include stretching and balancing techniques that are related to how the ligaments attach to viscera, the organs, and they may involve actually inherent visceral manipulation or motion. So there's a guy by the name of Jean-Pierre Borel, who is a non-physician osteopath from France, and I'm going to talk about that in a little bit. There's different types of osteopaths in different countries, and they're all a little bit different. But this guy is not a physician, but he's an osteopath from France, and he's developed a lot of these visceral techniques. All right, so you don't have to remember all that, but I just kind of wanted to talk to you about that. So in terms of diagnosis and treatment in osteopathic medicine, so again, the osteopathic philosophy, I said this earlier, kind of serves as a framework to organize the physician's thoughts and help them to understand what's going on with the entire patient. So it's looking at the patient holistically. The osteopathic diagnosis is going to be different from an allopathic or a medical doctor's diagnosis, in that in addition to a lot of the testing that they would do, they're going to perform probably more orthopedic and neurological physical exams. That doesn't oftentimes happen in a more allopathic setting. And they're also going to include, a lot additional palpating of muscle tissue, joint testing, those kinds of things. So that's where it would be different. Where it would be the same would be, in current day, some of the diagnostic testing, just a standard physical exam, blood pressure, that kind of stuff is still part of it. So the osteopaths use 4 criteria to diagnose somatic. And somatic, that word somatic means like body dysfunction. And the acronym TART serves as an abbreviation for these criteria. So one thing they look for is tissue texture, and this is going to be different from, I should say, back up for a second. This is going to be different from a conventional diagnosis. So one, they look for tissue texture abnormalities. That's for the T. For the A, they look for static or positional asymmetry. So if somebody's off, their symmetry is off, either when they're moving or they're not moving or they're being moved. If there's any restriction in their range of motion, that would be R, and if there's any tenderness. So these, again, are referred to by the diagnostic mnemonic TART. And the signs of abnormalities can then also be assigned to different spinal segment levels. And so that helps to kind of get, and they know, osteopathic physicians know a lot about this, that helps them to kind of get sort of a guide for where the problem actually is. Depending on where these abnormalities are found, it can point to, a mechanical problem. It can point to some kind of a visceral problem. It can point to all sort of reflex problem. All sorts of things can be elucidated from these criteria. So the osteopathic physician is going to pay more attention to the physical kind of the examination of both the internal organs and also the spinal cord segment levels. That's going to be different from a more conventional physician, I should say. And again, that's really going to be, it's based on that knowledge of structure and function, right? This is the key to their profession. There it is. So manipulation is central to osteopathic medicine. So it's, again, that interrelationship. So you can look at this from like a big picture kind of way, or you can narrow your scope and look at it from a microscopic level. So from the macroscopic point of view, it's easy to understand that there's pressure on a joint, a nerve, or a muscle, then there's going to be resulting tissue damage over time, right? That makes sense. The blood flow is impeded, lymphatic tissue flow is impeded. As we look at it microscopically, you look more on the cellular level, and of course cellular physiology is going to depend on fluid flow because you need to get oxygen, you need to get wastes removed, right? If that system is impeded, then cells, tissues, and organ function will be decreased. So again, remember the rule of artery is supreme. Osteopathic treatment adjusts tensions on these tissue tensions that allow for the fluid flow. That's what they were talking about there. That's the rule of the artery. Right? So it's not just, manipulation is not just decreasing or eliminating pain, right? It's really at allowing the body to perform optimally, right? That's really what it's all about there, optimal function. So you can see that, excuse me, that by adjusting the tension, you adjust what we call the body's tensegrity system. So that's a weird word, right? And so essentially what tensegrity means is it's basically a principle based on the use of isolated components in compression, right? Essentially inside a net of continuous tension. It's kind of a weird old term. So, you know, it's like if you were to kind of think about like, what am I trying to say here? Cables, you know, that are arranged, or bars or struts, you know, they don't touch each other, right? They're held in a state of pre-stress tension, essentially. And that's kind of how they get sort of held, that's kind of how they're organized spatially. So basically, what we're trying to do here when you're adjusting is you're basically trying to keep everything floating in such a way that's actually advantageous. Also, we're trying to prevent any kind of potentially deleterious stimulus at a macroscopic level, the buildup of toxic conditions in cells at a microscopic level, that kind of a thing. And again, so manipulation is central to osteopathic medicine. And from my point of view, it has been a lot of it has been lost, right? Because osteopathic physicians have almost become integrated into the allopathic profession. It's not that you can go to an osteopathic physician that doesn't do any manual medicine anymore, which I think is a disservice. I think that that's a great thing that they have to offer. I mentioned this earlier. I should have put it up when I was talking about the history of osteopathy, but I found this because I thought it was fun. You know, remember I said that Mark Twain actually testified in support of the osteopathic profession and to gain licensure in New York. And this was a quote from Mark Twain, which states, "To ask a doctor's opinion of osteopathy is equivalent to going to Satan for information about Christianity." I think that's hysterical. He was a big proponent of osteopathic medicine. All right, so I'm going to cut here, come back to talk about the current status of osteopaths in the United States.